This is Aging by the Bay, here to provide families in the San Francisco Bay Area pertinent information about healthy aging practices and services. Your host is Ajay Sani of ComForCare Home Care.
Good morning and welcome everyone to Aging by the Bay, where we provide families in the San Francisco Bay Area relevant information about healthy aging practices and services. I'm your host, Ajay Sani from ComForCare Home Care. With ComForCare, you can give your loved ones the best life possible, thanks to complete in-home care for every stage of life. Find out more at comforcare.com or call us at 1-800-886-4044. At Aging by the Bay, we talk about joys and some of the challenges of growing older in the Bay Area. We talk to experts what they see happening as people age, as well as the services that are available that you or your loved ones may not be aware of. First of all, I want to thank our sponsor, A Love for Seniors, who specializes in helping seniors find residential care homes, assisted living facilities, and memory care assistance. You can contact them directly at 1-800-850-9102. Their website is aloveforseniors.com. And again, their number is 1-800-850-9102. Today with me is Dr. Kuljeet Multani. She is a Bay Area physician who is triple board certified in family medicine, hospice and palliative care, and Hospice Medical Director certification. Currently, she is a palliative care physician with Palo Alto Medical Foundation and a hospitalist at Stanford Health ValleyCare in Pleasanton. She is also an associate medical director at Hope Hospice, a nonprofit organization that is serving the East Bay community for 40 years. Good morning, Dr. Multani, and welcome to the show.
Thank you so much, Ajay, for having me here and asking me to speak on a topic which is so passionate to me.
Excellent. So let's start. What we see, it's very challenging. And unfortunately, when we face any serious illness, it can be really overwhelming, especially to receive medical care and get information at that point of time. So maybe we can start today from a common person's point of view, and maybe you can explain what really palliative care is.
Sure. So palliative care is medical care which is provided to a patient who has been diagnosed with a serious medical illness. This could be a sudden diagnosis coming out of the blue, or it could be something which is going on for many years, and suddenly the patient is facing more challenges in regards to treatment, maybe not responding as well to treatment, maybe being hospitalized very often as a result of their medical problems, and also simply having a lot of side effects from the treatment and having an overall poor quality of life. So suffering on a daily basis as a result of what this patient has in terms of a diagnosis. So focus on palliative care is to provide quality of life care quality of life. The main focus is in treating patients in terms of quality of life issues that they may have, especially where quantity of life may start to look a little bit limited. Now, in terms of sudden illnesses, I can give you a few examples. Sudden illness can be in the form of cancer, and an illness which has been around for a long time could be something like congestive heart failure or COPD or emphysema, as we call it. And these patients are continuing to get medical care, but somewhere they're flailing. They're not responding as well to the same treatment or more treatment that they're getting. So the focus of palliative care really becomes focusing on not just the physical aspects of the suffering that a patient may be going through. And that is where doctors and nurse practitioners and physician assistants will step in to care for them. But also kind of looking at the psychosocial aspect of this. How are patients and families grappling with this discussion and this diagnosis and just the overwhelming feeling of having an illness? We also talk about spiritual aspects to palliative care. How do patients perceive their illness? Do they think that this is a result of something that they have done in the past? There's a lot of spiritual versus religious beliefs that patients can strongly associate with their illnesses. So that is where palliative care comes in and provides us more or less a very wholesome care. So we have a huge team on our at our sites. So typically, most palliative care teams will consist of MD, a doctor, a nurse practitioner, or a physician assistant. On our teams, we've got an MD and a nurse practitioner. We've also got social workers. We've got nurses. We've got care coordinators. And we've got a chaplain. So as a team, we provide full-on medical care to each one of our patients. We're supporting not just our patients, but we're also supporting the specialists who are taking care of these patients. So we're talking about providing an extra layer of support to all our specialists. The beauty of palliative care, and I always say this, is no one knows a patient as well as a palliative care team because we're exploring everything there is about to a patient. We do home visits for our patients. We do board and care visits, assisted livings. We see them in our clinics. We see them in the hospital. So we're really kind of following them wherever they are and getting to see them not just from the perspective of coming into the clinic, but also kind of seeing how they're functioning on a daily basis in their homes, right? So a lot of times our visits are combined. My social worker and myself will do a visit together just so that we can address as many issues together as possible. So that is really what palliative care does.
Very good, very good. I mean, thanks for, explaining it in a very simple way. So I just want to elaborate a little bit on the same, pretty much the same question, but it's more from like two questions, actually, I want to ask. One is like, when people realize that there's something really serious going on, and that can be, of course, a mental challenge to address that. So what do you see at that time, how people, both like from the patient point of view and also from the family point of view, what they feel at that point of time whenever that thing hits? Because sometimes we take things for granted, like, today I'm running, I'm 100% active, can do whatever I want to, and I don't even want to see that okay, down the line I may not be in that position to do the same things that I love to do today. So when that thing hits, what happens mentally, emotionally, physically, and all those kind of things? And also at that point of time, and you have touched already some of these aspects, it will be good if you can even further describe like what should be the ideal response and support from healthcare providers.
Absolutely. So I think for both patients and families, what becomes more obvious is that life is suddenly looking very limited. So it's looking limited not just in terms of, again, the quantity of life, like, am I going to die? That's a huge question, and it's scary, it's overwhelming. The second thing is that I have this disease, and how am I going to do while I'm on this disease? So it becomes a quality of life issue. How am I going to do? What does this look like for me going forward? How much time do I have? Will I suffer? Will there be pain and uncontrollable distress, especially towards the end of life? Is how people are perceiving it. How can I continue to take care of myself? And how can I stay as independent as possible? Because we have so many patients who are so desperately trying to hold on to their independence in such a situation. And they're starting to see that this may soon not be possible for them, and that they're going to have to make changes in their life, and their families are going to have to make changes in their life, which is going to affect them all. So if I'm not able to take care of myself, who's going to take care of me? And what will the treatment do for me? What does the treatment look like? I want to say to all these patients, because I feel so strongly in favor of patient empowerment, I just want to say you're not alone in this. We as a team can step in and help you take care of all these issues, all these thoughts that are going through your mind, because we're here to explore the best options possible with you. We don't make decisions for our patients. We help them make the best decision possible based on the information that we're going to give them under the circumstances. So I start by saying that, one, you're not alone. All of this care that you're going to have right now is going to be communicated with all the doctors and the other medical teams that are taking care of you. I call it kind of like tightening the purse strings. So it's like we're talking together, we're having clear communication. If I see a patient, I reach out to all the doctors involved with the patient and say, I saw your patient today. This is my recommendation. These are the medication adjustments that we've made. This is the plan going forward. Let me know if you think any differently, and we can all share this opinion again. So we continuously talk between the providers. I say to patients, we can treat your symptoms and side effects from the treatment. As you go through the treatment, we can try to keep you out of the hospital for things that you don't need to be in the hospital for, which is a big deal for a lot of patients.
Yeah.
We can help arrange resources for you, such as home health, private caregiving, help on the in-home support services hours that a lot of patients have. We can arrange outpatient therapy. We can have nurses coming home and taking care of your blood work for you, physical therapists, occupationals coming home health aides. So we can arrange a lot of that. We keep a regular tab on you in terms of progress and your response to disease. And each time we meet, we talk about what your goals of care are. Have they changed from the last time that we've met and talked about? And then we work with you to help you achieve what's most important to you. So treatment may not be the most important priority for a few of our patients, right? They're very different things. There are a lot of things that people feel like they still want to achieve. And sometimes the focus becomes all about what they want to achieve in the time that they have versus trying to focus on treatment, which may not work for them.
Very good. Essentially, I mean, what I'm hearing is that in this uncertain world, it's a question of like quality of life.
Sure, yeah.
Because sometimes we just think about like, people who are really ill or whatever, but as a matter of fact, no one knows.
Yes, that's true.
That's the reality of this uncertain world. And then moving on, like as a patient, I may go to any medical facility based on, what is closest to me or also what my insurance coverage is and so forth. But do you have any suggestions for people regarding like how to pick a provider? And here, just to clarify, I'm not saying that, one provider is better or worse than the others. It's like, they all are doing a great job in helping people, really taking care of people. So they all are good and doing a very noble thing, helping people out there. But based on your experience, do you see that a patient or family should be aware of certain things and explore a provider that matches his or her specific needs and wishes?
Absolutely. That's an excellent question. Again, I believe that, you can have excellent doctors and nurse practitioners and who can take great care of you, but the right click is important. So I always ask my patients to explore the option of whether this provider is going to work for you or not. So this doctor may work very well with another patient, but it may be a different setting or a situation with you. So I always say explore your options. Right. One thing I would always recommend is asking your own doctors who've cared for you, such as your primary care doctor you may have known for years, and can recommend to you who a good provider or a good fit for you might be. The second thing is something which we call meet and greet. Ask to meet your provider. Explore your options. Explore your philosophies with your doctor. And see if that matches with and is in tune with what you really want for yourself, and you feel like this will be a good relationship going forward. It's a good marriage. So you're looking for a good marriage at the end of the day. And we're in it for the long haul. And I also say that palliative care can almost be such an intimate relationship because, like I said, we're exploring so much about your life and kind of helping you in the most intimate and personal ways possible. So I think it's really important for patients and providers to feel comfortable with each other. But patients should feel like they have the right to do so, and they should go ahead and explore those options with their doctors.
Just listening to you, I feel, this is my observation, that one of the qualities should be that there should be a lot of patience to interact with the patient. It's not like, okay, let's move on, this is what it is, and give a quick recommendation or suggestion and then move on. It's like the providers need to be very patient with the patients.
I can give you an example on this. So many years ago when I was actually doing primary care, along with palliative care, I had a really young family who was looking for a new PCP. And this family approached me with a meet and greet. And the lady had, in a very unique way, strong beliefs in preventive medicine, spiritual care, and quality of life. Those were her top three. And she wanted to know, with younger families, you don't kind of expect a lot of that. But here's someone who really had a very, very different view in terms of what she wanted. And So I was interviewed for the job, and she signed me up as a primary care doctor. I think our philosophies matched. We did well. I moved on from primary care, but years later, I'm still their palliative care doctor on record, even though she has no palliative care needs right now. So I think it is really important for patients to feel like they have the ability to reach out and explore their options.
This is really great information. So now, how do you see the new healthcare environment during and also post-COVID-19, whenever that post will come or whatever that new normal, as some people are saying, will be? What's your thoughts?
Yes. So this is these times have certainly changed for all of us. And I think with the suddenness of it all, we had to rapidly escalate and improvise on the way that we've been caring for our patients. So previously, while we were doing these home visits and clinic visits, we've had to we realized that our patients are going to continue to stay sick through this.
Right.
And we still have to reach out and make sure that we're caring for them to the best of our ability. So definitely telemedicine has been a huge boon for us in terms of that, because through this crisis, which continues and will probably continue for months on end, we have learned to still continue to keep a check on our patients, making sure that they're doing okay, being able to address any urgent needs. Through this, we've continued to do urgent visits to their homes, wearing PPE, and addressing any needs that they have on if they have uncontrolled symptoms like pain going on or appetite issues or energy issues. We've still made those visits to our patients' homes just because we want to make sure that they're doing okay. And over the next few months, we do realize that this is still going to change. While video visits have worked really well right now, I call palliative care a very touchy-feely specialty, and our patients want to be seen, right? There's nothing better than hands-on care given by a doctor to our patients. So we have realized that we're going to have to do a balance of both and not just mainly telemedicine. So we are working on ways to make sure that we can continue to see our patients the way we were. It'll probably be a good balance. It may not be a lot of mostly face-to-face visits, but I think it'll be a good balance of who needs to be seen and who can be better off with the video visit. I think some of our older population can have challenges with video visits and using smartphones and technology like that. So we want to make sure that we're still reaching out to them face-to-face and actually caring for them.
Yeah. And I guess same goes for the family members too. Pretty much in some cases they want to meet and they want to know what's going on with their loved ones.
Yes.
And especially a lot of times the family members, they are not living in the same place or if sometimes not even the same city or state or so forth. So it makes it both like teleconferencing and all that, and also whenever get a chance meetings. It's like, how do we balance in this new environment where accessibility has suddenly been reduced?
Limited, absolutely.
In terms of
and
what
so
we can do.
We're doing that with our patients. We're doing visits face-to-face, or we're doing a video visit, but we're also updating our family members with what's going on with them. So there is a lot of communication, a lot more communication than we were previously doing, which is good.
Right. So as we are moving towards the end of the show, if there is anything I should have asked and I didn't, or, just you want to share sort of any thoughts, suggestions that you think our listeners may benefit during these times, please, it's all yours.
Thank you. So I am a big advocate for frank, honest discussions. And I always give my patients a heads up that is who you're going to get if you're going to be cared by me. I want to be frank. I don't want to dilly-dally and kind of give them information which may not be specific or they may be confused with. So I ask my patients to do the same. And there will be times during our care where we will continue to have some really difficult conversations. And I say this, once we get past the difficult conversations, we can focus on the more immediate, more positive aspects to this, and really short-term gains, as I call it, which we can help our patients to achieve. So I ask my patients to empower themselves. I ask them to speak their mind. communicating with your family and with your providers is really important in terms of what your wishes are for yourself.
Okay.
A lot of times we find that patients hold back their feelings because their family members want them to continue to fight a certain disease, which may not be possible. And it goes both ways.
Right.
So I always encourage families and patients to communicate to each other, and we help facilitate those conversations. I would ask patients to complete their advanced care directives and the pink forms, which are called the POLST forms, very critical to their care, absolutely critical, especially if there's something that they do not want in terms of medical treatment. I also want to say that saying no to treatment is an option, which a lot of patients don't think that they can come out with and say directly to their doctors. And I want to say that saying yes to treatment is an option, saying yes to some treatment is an option, but saying no to treatment is also an option for you. So I also say that the earlier you communicate and complete your advanced care directives, it is better because you'll have some more time to think about the decisions that you've made and feel comfortable with those decisions. So doing things more early rather than waiting till the last minute, because sometimes patients will have this feeling that they have time. And unfortunately, I think that can be very that's not something that any of us can be sure about.
Right.
So that's really important. I also want patients to discuss situations where they may want to do something differently in their life rather than focus on treatment options which may not work for them. I say this, nothing is good or bad or right and wrong in palliative care. It's what you choose for yourself after being given the information by your medical team based on your diagnosis and treatment. So choose something that you feel will work best for you, and that is something that you honestly believe in. And most of all, explore your fears of the disease with your doctors. The more you talk about it, there are so many questions and fears which can really be allayed by your medical team by just talking about it. Because a lot of times we realize that something which could be so big in a patient's mind is actually can be simplified and explained and rationalized to be something that we can absolutely work with and in keeping them comfortable.
Very good. I mean, this is really very, very useful from one point of view that what we discussed today is very challenging and complex, thinking from the patient's point of view and the family point of view, what they go through during these times. And the way you explain, it makes it very simple overall, though it's very complex, but still simple in the sense that it's all about what we want, make the best out of no matter what the situation is, because there is always a way to look at like what we want to do, what we want to achieve, and a positive outlook can really do wonders.
Absolutely. I only look at palliative care as a very positive field where patients can get the best care possible suited to just their individual needs. And really the outcomes of patient satisfaction and healthcare outcomes can be improved by just having discussions around and care around difficult diseases.
Right. So true. And with positivity, we can not only improve the quality of life, but also at times, like if we are positive, we can also increase the quantity, if I may say so.
Absolutely. And there has been scientific data and studies which show that having palliative care on board can help not just improve your quality of life, but also quantity of life, especially in certain kinds of cancers.
Right. Thank you so much today for sharing this and giving your perspective. And I'm very sure that listeners would have really enjoyed listening to you today.
Thank you so much, and it was my pleasure to be on the show.
Okay, so thank you for joining us on Aging by the Bay today. This show was brought to you by ComForCare and A Love for Seniors. This weekly show provides information that helps our seniors age better. Please visit our sponsor website, aloveforseniors.com. You can contact them directly at 1-800-850-9102. We hope that you enjoyed the show, and please subscribe to our podcast that is available at iTunes, Google Play, Stitcher, and SoundCloud. You can find this show and also previous shows at our website, agingbythebay.com. We love your feedback, and so please leave your comments. If you have any question for our featured guests or want to become a featured guest, please contact us by sending an email at info@agingbythebay.com. Again, a big thank you to our sponsors, A Love for Seniors, and to ComForCare Home Care. This has been an Aging by the Bay show addressing issues on aging and services available for our elderly population. We will be back next Saturday at 10 a.m. Until then, take care, be safe, and have a wonderful week.
This has been Aging by the Bay with Ajay Sani, addressing issues on aging and services for the elderly community. Join us again next week for Aging by the Bay.